Hi, I'm Danielle Matus at Caring Medical Florida, here with our patient Crystal. Crystal, what first brought you to Caring Medical?
Well, I first saw you in the Chicago office back in 2017 where you gave me my EDS diagnosis.
EDS meaning Ehlers-Danlos Syndrome.
Yes. And I couldn't pay at the time to get for treatments. And so after I got married, my husband decided we were going to start, but we didn't know when. I had multiple injuries to my ankle, and it wasn't getting better. And I was having extreme amounts of pain. We went to my doctor. She gave me a x-ray and an MRI, showed nothing, but there was so much pain in there I couldn't do anything, and I was screaming as she was talking to me. And my husband's like, okay, that's it. We're going to Caring Medical. Doctor doesn't know what's going on. We're not going to go through the hoops. This is getting serious. Let's go.
And it was pretty serious. You know, so we've seen you for several months now getting treatment, but I recall the first time you were here, I couldn't even touch your ankle. Like, we had to actually do sedation on you to even be able to move it and test your stability because your pain was so outrageous.
Yeah, it was. I was in another world. I'm sitting there, I'm like, okay, how am I going to handle shots if I can't even handle someone touching my foot?
Yeah, and it was, you know, in your case is a little unique, but probably is, you know, affecting people all over the world, where you have Ehlers-Danlos Syndrome, so you're naturally a little bit more bendy, right? A little bit more flexible. And then you have, you know, these traumatic ligament injuries to your ankle that went on for so long that you actually developed complex regional pain syndrome.
Yes.
So just severe nerve dysfunction in that area, which is why it was so tender for me to even be able to touch it on day one.
And we got home and I was doing all the research on CRPS, and I could not believe that had actually happened.
Yeah.
I didn't even know it existed, and when we were sitting there doing the research, it was insane.
It is, and it can be very detrimental to life. You know, you today, you have this boot on and you still use a scooter, but, you know, maybe compared to before you started and after treatment, how are you doing with weight bearing now?
When I came down, I was pretty much bed-ridden. We had just moved into a new house, and so I was literally crawling around the house just to get things that I needed. Luckily, I had a friend who had an extra wheelchair from my local EDS support group. She let me borrow her wheelchair to get me around, and that's how I was getting around, was through a wheelchair. I still do at home, but I am starting to walk. It's been, 8 months since my first treatment, and I am now just starting to take steps again.
Which is great. And we've been having you do some weight bearing, like in your kitchen, just kind of standing to bear weight to help those nerves regenerate, and that's been going very well.
Yep, I have a rollator now at home so that I can practice without having anything to hang on to. I can actually now freestand now for about 12 minutes.
That's amazing compared to crawling all over your house. One thing, too, that you mentioned, I can't remember if it was your last visit or the one before, but you noticed that when you were laying in bed, your foot stayed up.
Yeah.
It didn't just flop to the side.
Yeah, which with EDS, you know, it's very floppy, very bendy, and now it really doesn't do that.
That's amazing. You know, I think a lot of times, especially in this office, you know, people might think regenerative medicine, athletes and, you know, sports performers, but really people, normal people like us, you know, that want to be able to stand in our kitchen and, you know, not crawl up the stairs and so forth. I get really, really excited, and I'm sure I'm obviously much more excited for you, but very, very excited about the little gains that affect just our normal life.
Yeah,
you know,
being able to step was very overwhelming. I was about ready to break down because I hadn't been able to walk in longer than 8 months. I started treatment about 8 months ago. I was dealing with the pain about 2.5 months before coming down here to get checked out.
So for 10 months, maybe almost a year, to not be able to take a step because of the pain.
Yes.
This is huge. You know, it might be simple to some people, but to you to actually be able to walk on your feet in your house, that's amazing.
Yeah.
Yeah. You should be very proud of yourself.
the fact that soon I'm going to be able to unpack my house.
Yeah. Yeah.
We lost our condo when a tornado blew a tree into it, and we were displaced for over a year.
Wow.
And the injury happened while we were in displacement and couldn't do anything about it. And once we got into a house, we decided to start doing something about it.
I love it. One last thing too that I think, especially with the CRPS, nerve component, with that is a lot of nerve sensitivity. So even like touching the ankle or touching the foot, can be very painful, just even like a light touch. And now we have you like attaching like TENS units and like,
Yes.
nerve stimulator things to it, and you're tolerating it very well, which would have been out of the question 8 months ago.
Yeah, just imagine the breeze created by somebody walking by causing incredible amounts of pain that you want to cry, to now handling touch, vibration, fabrics, starting to walk again. It's a little bit overwhelming, but in a good way.
It's amazing. Like I said, you should be really proud of yourself because you've come so far.